I am not a medical professional. The information provided in this video is for informational purposes. Please consult with your healthcare provider for medical advice.
Dr. Sebi, one of the callers just sent, one of the listeners that listens to the show a lot, did send a text message, and he would like for you to elaborate a bit about diabetes and dialysis. We see now that diabetes is up on the top of the chart with, on the illnesses that affect us, a lot of our people.
You know that diabetes is one of our specialties. Over a dozen or more, and I'm going to name one in particular, Larry from New Jersey. He's a policeman. Larry came to me in Honduras with diabetes at 600 level sugar. In 4 days, his sugar was normal. He came on Monday, and the Thursday his sugar was normal. The Nigerian doctor that came from Canada with his wife, he didn't want to come because he thought that I was a voodoo man, that I was some kind of off-the-wall herbalist. No, I'm not that. I'm somebody altogether different. I'm a different animal. 4 days later, his sugar was gone. What is it that I'm doing? Okay, I'm doing a simple little thing. I cleanse the pancreas duct. They usually say, they normally think that when a person has diabetes, the pancreas stop functioning. No, if your pancreas stop functioning for 1 minute, you are dead. What occurs is that the ducts of the pancreas, through which the insulin travels to get to your bloodstream, are clogged. I unclog them. It takes me 4 days to unclog them. And there goes your insulin again. Then I repair the damage in the core of the pancreas. They call that the islet of Longerhorns. I begin to clean them out because they are clogged up with that what? Carbonic acid. You've been eating a lot of starch. Now, dialysis, again, there is obstruction in the kidneys. Usually, or normally, it is calcification in the kidneys. Kidney stones, they call them. And all kind of other things caused by what? Inflammation. There is only one disease. There never been two. There's only one disease that exists. When I said that to the Supreme Court, they didn't want to accept it. But when I broke it down, they had to accept it. When we talk about the dialysis and we talk about the other one, which is the pancreas, diabetes, you are talking about obstruction. The mucous membrane has been broken down, clogging the system. We have to clean it out. If that occurrence takes place in the brain, you become crazy. Or Alzheimer's, if it occurs in the joints, you become arthritic. Anyway, the mucous membrane has been compromised, a disease will be present. So yes, with dialysis, again, we break down the calcification and flush it out. We have taken people off the dialysis in 24 hours. Others, it take me up to 2 months, but eventually, they will be off. They will be off. Dialysis only means that the patient has been ingesting a lot of starches.
According to Dr. Sebi, diabetes is caused when the pancreatic ducts are blocked. Dialysis is the calcification of the kidneys and is caused by consuming too much starch. If you have diabetes, you have mucus in the pancreatic ducts. Through fasting, you can remove the mucus so that your pancreas can begin to function properly again. You must abstain from eating and fast on sea moss, herbs, fruit smoothies, and green juice. You may have to fast several times in order to remove the mucus. In order to heal the kidneys and get off dialysis, you must stop eating starch and eat foods on Dr. Sebi's nutrition guide. You also need to increase your iron and gradually add potassium phosphate. There are certain steps in the healing process that cannot be avoided if you want results. These things will always remain the same regarding healing from any disease. You will need to cleanse by consuming Irish moss, spring water, herbs, alkaline fruit smoothies, as well as tamarind and green juice. You will need to revitalize after fasting, by making sure that you consume herbs to nourish and replenish the body while strengthening the immune system. And you will need to eat foods from Dr. Sebi's nutrition guide. There is a link in the description box below to download a copy. In addition, you will also need to consume at least 1 gallon of spring water per day. Dr. Sebi says that in order to rid the body of disease, we must cleanse the skin, the liver, the gallbladder, the lymph glands, the kidneys, and the colon. I'm going to go over a few herbs that help to cleanse each of these organs, as well as other herbs that help to heal the pancreas and the kidneys. Cascara sagrada. It causes muscle contractions in the intestines that help move stool through the bowels while stimulating the liver and pancreas secretion. Rhubarb root. It's a highly effective laxative that helps improve tone and health of the digestive tract. It also cleanses heavy metals and kills harmful bacteria. Blessed thistle kills fungus, stimulates the upper digestive tract, increases circulation and oxygen to the brain, and supports heart and lung function. Burdock root cleanses the liver and the lymphatic system. It also helps to eliminate toxins through the skin and aids in the filtering of impurities through the bloodstream. Dandelion cleanses the kidneys, gallbladder, and the blood. It also dissolves kidney stones. It provides relief from liver disorders, diabetes, urinary disorders, and is rich in calcium. Elderberry removes mucus from the upper respiratory system and lungs. It increases urine flow and induces sweating. Mullein cleanses the lungs, removes mucus from the small intestines, and activates the lymph circulation in the chest and neck. Chaparral cleanses the lymphatic system and gallbladder. It also clears heavy metal from the blood and helps to treat diabetes. Guaco cleanses blood and it cleanses the skin by promoting perspiration. It also reduces inflammation, increases urination, and promotes healthy respiratory system. In addition, it is high in iron and strengthens the immune system and has potassium phosphate. I'll now go over the revitalizing herbs used in Dr. Sebi's endocrine compound. The first set of herbs will be for diabetes. Nepal or prickly pear cactus reduces type 2 diabetes, high cholesterol, and obesity. Some preliminary evidence shows that prickly pear cactus can decrease blood sugar levels in people with type 2 diabetes. Warike is a great herb that lowers blood sugar levels, treats diabetes, and reduces weight. It also nourishes and cleanses the pancreas. It works very well in combination with bitter melon. Prodigiosa stimulates pancreas secretion, reduces blood sugar level, and promotes fat digestion in the gallbladder while improving stomach digestion. Although this was not used in Dr. Sebi's endocrine compound, it is also a great herb or food to add. This is bitter melon. It reduces blood sugar by improving the way that glucose is used in the tissues and promotes the secretion of insulin. A 3-month study on adults with diabetes showed that taking 200 milligrams of bitter melon daily decreased blood sugar and hemoglobin A1C. Another study on 40 people with diabetes found that taking 200 milligrams per day of bitter melon for 4 weeks led to a modest reduction in blood sugar levels. Another great herb is the sensitive plant, also known as tea Marie. It lowers blood sugar level if you drink the juice of this plant. Drinking 30 milliliters of this plant juice in the morning and evening showed within 7 to 10 days a noticeable difference in blood sugar levels. Stinging nettle treats diabetes, poor circulation, and other endocrine disorders. Anamu lowers blood sugar and has been used in herbal medical practices in Cuba as an aid for diabetes for many years. Hierbo del Sapo is best for lowering cholesterol and triglycerides, but it also helps clear arteries, helps with type 2 diabetes, kidney stones, and other kidney problems.
You are on dialysis?
Yes.
Get the iron,
Iron?
the liquid iron.
Just iron?
Iron. Just take the iron for now.
Okay.
Because what happened, we take your creatinine level test, they're going to tell you that creatinine is high, right?
Yeah.
Or that potassium may be high if I give you what you really need right now. But I could begin, and this is how I begin people on dialysis. This is going to give you energy. What this will do, they wash your blood to remove the impurities. They also wash out the minerals that makes you strong. That's why when you get off the dialysis, you're hungry.
Yeah.
You want to eat
Yeah, definitely.
because they rob you of your energy. Well, if you take about 6 tablespoons of this, you can feel that. I would have replenished the minerals. Then gradually I would begin to give you potassium phosphate to open up the kidneys so that your urine could start again and a diuretic. We have done it. We have done it before. But like I said, those of us that we treated, because they couldn't maintain that diet, it was difficult. But this one man said, I'm going to go all the way with you, and he's off the dialysis machine.
Say that again.
Because he adhered to the diet,
Oh, okay.
he went along with the diet that is most unnecessary.
Regarding those who are on dialysis, as you heard from Dr. Sebi, it is very important that you stick to an alkaline diet once your kidneys are healed if you want to stay off dialysis. Otherwise, you can relapse and go back into a diseased state. You should consume lots of iron and gradually take the potassium phosphate along with the diuretic herbs. I will go over herbs that provide iron and potassium phosphate as well as diuretic herbs. These are revitalizing herbs for dialysis. Lily of the Valley is a great herb for those on dialysis. It is rich in iron, fluorine, and potassium phosphate. It's also used as a natural diuretic for kidney stones and as a cardiac tonic, and it addresses the central nervous system. Sarsaparilla root is the best source of iron and it is necessary for healing. Jamaican sarsaparilla is highly recommended. It is also a natural diuretic. Kankansa is an African plant. It has the highest concentration of potassium phosphate. Irish sea moss contains 92 of 102 minerals that the body needs, including zinc, magnesium, iodine, bromine, calcium, iron, phosphorus, potassium, and selenium. Wild-crafted Irish moss is best. Bladderwrack is a natural diuretic that flushes excess stagnant fluid from the body, removing dead cells. It's high in magnesium, calcium, phosphates, and other minerals. Stinging nettle and dandelion are herbs that I mentioned previously, but they are both traditionally used as diuretics. I know that this is a lot of information, but you can reference this video anytime to go over the information again. Just to keep things simple regarding those with dialysis, Dr. Sebi recommends taking iron and gradually taking potassium phosphate along with the diuretic. Based on this, I recommend 3 herbs from the list of herbs that I just mentioned. Sarsaparilla, which has the highest concentration of iron, Lily of the Valley, which is rich in iron and potassium phosphate and is also a natural diuretic, as well as dandelion, which is traditionally used as a diuretic. These are a few simple herbs to start with, but as Dr. Sebi states, you must be willing to stick with an alkaline diet. Many of these herbs can be found on my website at www.alkalinemillideas.com. I do also offer a total cleansing package, which includes all of the herbs that you need for the cleansing phase of your healing process, as well as several other herbs mentioned in this video that help with the revitalization. Due to many requests, I am also in the process of getting in sea moss, Irish moss, that comes from a very reliable source and that will be updated on the website once it is available. For those of you who are looking for some recipe options using foods from Dr. Sebi's Nutrition Guide, you can also find volumes 1 and 2 of my Alkaline Meal Ideas cookbook, along with a bundle offer that comes in paperback form and also ebook form of these cookbooks as well. Again, these can be found on my website, www.alkalinemealideas.com. As Dr. Sebi stated, disease can only exist in an environment that is acidic. Only consistent use of natural botanical remedies will effectively cleanse and detoxify a diseased body, reversing it to its intended alkaline state. For testimonies from members of my Facebook group who have been healed from diabetes, hypertension, cancer, and various other illnesses, the link will be in the description box below.